Okay.
Okay, so for our community group project, we chose to do it on asthma. So I'm Sam.
I'm Supin Chen.
And I'm Hayat Salmani.
Awesome. So we're going to go to the first slide, and it's going to talk about what is asthma. So asthma is an obstructive lung disease, which is a condition that makes it hard to exhale all the air in the lungs, while restrictive lung disease like pulmonary fibrosis means that the lungs have difficulty fully expanding with air. Both type of diseases share very similar symptoms, but Suping will go over those in the next few slides. So there are these things called asthma attacks, which may include coughing, chest tightness, wheezing, and trouble breathing. The attack happens in your body's airways, which are paths to the carry air in your lungs. As the air moves through your lungs, the airways become smaller like branches of a tree. During an asthma attack, the sides of the airways in your lungs swell and the airways shrink, which means that less air gets in and out of your lungs and mucus that your body clogs up the airway. Let's see. So yeah, the airways of the lungs get inflamed, become narrow and swell, and as I said, they produce mucus. And there's more coughing and chest tightness at night and early in the morning. So if you have asthma, you have it all the time, but you'll just have asthma attacks only when something bothers your lungs. Currently, there's no cure to asthma, but it is treatable, and it's you are able to control it. So next slide. I'll talk about asthma relation to communities. So as you can see on the chart to the left, these are charts that were pulled from the San Joaquin County Community Health Needs Assessment. Asthma is not only very prevalent in this county, but all over the United States. According to the CDC, 1 in 13 people have asthma. This disease does not only affect one certain group, it could affect all age groups and ethnicities and such. So there are many disadvantaged populations that are affected by asthma. However, there have been many improvements and innovative interventions that have been made that are sustainable and attainable to these certain populations. Proper asthma management may be hard when you are worried about paying for basic needs like housing, clothing, and food. The cost of care may impact going to the doctor and buying medicines, and also a lack of transportation may affect attending regular health care appointments. If your finances are affecting asthma management, you can look for local resources that may help. There are also free clinics that will treat anyone regardless of insurance status or ability to pay. There are also organizational groups that help improve environmental conditions and also the need for implementing these communities with educational interventions while enhancing the access to these preventative medications. Just one example of an organization would be the Easy Breathing Program, which consists of decision support tools to help clinicians discuss and diagnose managing asthma. The program has been associated with 35% reduction in admissions and about 30% reduction in emergency department visits in Medicaid insured children. So Suping's now going to talk about symptoms and risk factors and treatment.
Okay, now we're gonna talk about the symptoms of asthma. People have asthma may have below symptoms: frequent cough, especially at night, wheezing, which is a whistling sound that occurs during breathing, usually during expiration through narrow airway, chest tightness, and shortness of breath. Symptoms vary among affected individuals. Some people have mild symptoms that occur infrequently, while others have more frequent or more severe symptoms. Severe asthma attacks can be life-threatening. Okay, next. There are a number of factors can increase the risk of developing asthma. Understanding the risk factors is essential to manage asthma. They include family history. If your parents have asthma, then you have a greater risk of developing asthma. Upper respiratory infections. Some people who have experienced respiratory infections go on to have chronic asthma. Besides these two risk factors, it also have others cause asthma, such as smoking, dust, animal dander, pollen, and obesity. Okay, next. We talk about the symptoms and risk factors of asthma. Now let's talk about the diagnosis of asthma. To diagnose an asthma, healthcare providers will do a physical exam for patients, and they also will ask patients some questions about their size and symptoms. Through physical exam, they can rule out other possible conditions. For patients such as a respiratory infection or COPD, then they can start the treatment for patients. Patients may also be given lung function tests to determine how much air moves in and out as they breathe. The tests include spirometry, which the tool for checking how much air people can exhale after a deep breath, and how fast they can breathe out. Another test is P-flow. A P-flow meter is a device that measures how hard people can breathe out. Lower than usual P-flow reading are a sign that people's lung is not working well, and that their asthma may be getting worse. Additional test is nitric oxide test. This test measures the amount of the gas nitric oxide in people's breath. When people's airway are inflamed, which a sign of asthma, that means they may have higher than normal nitric oxide levels. Imaging test, which a chest X-ray can identify any structural abnormalities or disease that can cause or make breathing problem become worse. Okay, next. Treatments of asthma usually involve learning to recognize your triggers. They classify two categories: long-term medications and quick relief medications. Long-term asthma control medications are taken daily to keep asthma under control on a day-to-day basis. They include the following: inhaled corticosteroids, such as fluticasone, propionate, budesonide. These medications are used for several days to weeks before they reach their maximum benefits. Leukotriene modifiers, such as montelukast, zephyr-lukast, are oral medications help relieve asthma symptoms. Combination inhalers, such as fluticasone, salmeterol, budesonide, formoterol. The offering is a daily pill that helps keep the airways open by relaxing the muscles around the airways. For quicker relief, rescue medications are used as needed for rapid Stockton symptoms relief during an asthma attack. They include short-acting beta-agonist albuterol and level albuterol, and quick relief bronchodilators add within minutes to rapidly ease symptoms during an asthma attack. Anticholinergic agents, ipratropium and tiotropium, like other bronchodilators, act quickly to immediately relax people's airway, making it easier to breathe. Oral and intravenous corticosteroids, prednisone, and methylprednisolone are medications that relieve airway inflammation caused by severe asthma. They can cause serious side effects when using long time. So these medications are used only on a short-term basis. Okay, next.
All right, so while doing our research, we found a lot of different health resources in San Joaquin County. First is the St. Joseph Medical Center educational events on asthma. They offer workshops, classes, and support groups to help people with asthma for management and treatment. Second is the Health Plan of San Joaquin, which is a program designed to help people control their asthma. By participating in asthma program, members learn what their medication do, the proper use of inhalers and spacers, trigger avoidance, and ways to participate in and enjoy physical activities. And also to know ways on how to identify early warning signs of asthma attacks before it happens. The San Joaquin County Asthma Coalition is composed of approximately 45 local agencies and organizations. Members volunteer their time to meet and strategize approaches to making San Joaquin County an asthma-friendly community. San Joaquin Public Health offers a wide variety of programs on health promotion and disease prevention. There are different health insurance programs available in San Joaquin for San Joaquin residents and make it easier for them to get access to healthcare when needed. Examples would be Medicare, Medicaid programs, and community health clinics. Now we learned about some of the resources available in San Joaquin County. Let's learn how these resources benefit the residents. First, by providing education about asthma, people will know better ways to manage their condition and prevent it from happening. Also, by educating them about the symptoms of asthma, it is more likely for them to seek for medical help before symptoms get worse. These resources will also help people know where to look for help and what centers provide the proper treatment needed. And lastly, by providing these resources, that can help decrease in the numbers of deaths in the San Joaquin County. Together in this project, we learned about asthma, about this condition, and the symptoms to look for when caring for our patients. We also learned the proper treatment and how to manage asthma in the healthcare setting. Another important information we learned from this project is how it can affect people with different ages. We also found great resources for people with asthma. These resources can help people provide education and support to those in need. Finally, asthma is a topic of Healthy People 2020. It is discussed as a subtopic under the respiratory disease. The main goal is to promote respiratory health through better prevention, detection, treatment, and education efforts. Under this goal, Healthy People 2020 lists several objectives such as reducing asthma deaths, hospitalizations, and emergency department visits. To conclude our presentation, this is a list of references we used for this project. Feel free to click on each link to learn more about asthma. Hope you enjoyed our presentation, and thank you.